Have you been researching Medicare plans and want to know how a Medicare supplement plan works? Be sure to stick around for important coverage details that you don't want to miss. Hi, I'm Shawneen Sullivan, founder of USA Medicare Plan, where we help people on Medicare find low-cost options for Medicare supplement and prescription drug coverage. In this video, I'm going to show you how Medicare supplement plans work and how you can benefit from this type of coverage. Medicare supplements provide additional coverage beyond Part A and Part B, known as Original Medicare. Medicare supplement, also called Medigap plans, help to fill in those gaps that Original Medicare Parts A and B don't cover. You'll need to be enrolled in Medicare Parts A and B in order to get a Medicare supplement plan. Medicare Part A is your hospital coverage, and Part B covers your medical up to 80%. If you only have Original Medicare Parts A and B by itself, you could be out of pocket an unlimited amount with no maximum or cap. This could be equivalent to 20% of all your medical costs, plus co-pays and deductibles associated with Medicare Parts A and B. So it makes sense for you to pick up a plan that puts a cap on your possible out-of-pocket responsibility. One way to do this is by purchasing a Medicare supplement plan, which would be a secondary insurance to your Medicare. If your medical treatment or service is covered by Medicare, then by law the insurance company has to pay their portion of the bill. These Medicare supplement plans are administered by private insurance companies. You'll pay a monthly premium in addition to your Part B of Medicare premium. The monthly cost of a supplement can vary greatly and is based on factors such as age, location, tobacco use, and possibly medical conditions. There are no networks, and you can see any doctor or provider nationwide that accepts Medicare. Medicare supplement plans are lettered A through N. They're standardized by the government, and this means that benefits for each plan offered are exactly the same from company to company. A Plan G with one company is the exact same Plan G with another company. The only difference is the price. As you can see in the Choosing a Medigap Policy Guide published by the Centers for Medicare Services, it states here that different insurance companies may charge different premiums for the same exact policy. The three most popular Medicare supplement plans are Plan F, Plan G, and Plan N. We'll go into much more detail on each of these plans in another video. It's important for you to know that you can't have a Medicare supplement plan at the same time you have a Medicare Advantage plan. They're two different types of coverage. Medicare Advantage plans are not Medicare supplement plans. Medicare Advantage is called Part C of Medicare. Some common types are HMOs or PPOs. Also Part D drug plans, Medicaid, employer plans, TRICARE, veterans benefits, and long-term care insurance are not considered Medicare supplements. The best time to buy a Medicare supplement is when you're in your open enrollment period. Open enrollment begins the first day of the month that you turn age 65 and start Part B of Medicare. This period lasts for 6 months. If you're over age 65 and you've delayed Part B because you or your spouse were still working, say, then your open enrollment will start on the effective date of your Part B and lasts for 6 months. During this time, you can apply for a Medicare supplement without having to answer any health questions or medically qualify. You don't pay any more for this right, and you're guaranteed acceptance. After you're outside of your open enrollment window, which ends 6 months after your Part B effective date, then you'll have to medically qualify by answering health questions on the application. And each company has their own health questionnaire. Every company has their own guidelines, and some companies are more lenient than others when it comes to things like heart issues, diabetes, or cancer history. We're familiar with each company's medical underwriting, so we can recommend companies that'll have the best chance of getting you approved. If your health has been good, then more than likely you won't have a problem getting an approval. But if you have pre-existing conditions, depending on what it is and for how long, then some companies may not approve your application. There are also other guarantee issue situations where you have the rights to buy a Medicare supplement policy, so if you have any questions, just give us a call. You can submit your application for a Medicare supplement up to 6 months prior to the effective date of your Part B. This would allow you to possibly get the lowest prices by shopping ahead of time. If you want to switch your Medicare supplement plan because you want to save money on your premiums or some other reason, you can do so at any time of the year, as long as you can qualify with the new company. You won't have to wait for an annual enrollment period like there is for Medicare Advantage plans or prescription drug plans. Some states have special rules that allow you to change during certain times of the year without having to answer health questions on the application. If, say, you wanted to switch to another type of coverage, like a Medicare Advantage plan, then you would need to be in a specific enrollment period or a special circumstance in order to do this. It's important to know that there are some things that Medicare supplement plans don't cover. Medicare Part D, which is prescription drug coverage, is not included in a Medicare supplement plan. You'll need to sign up for a Part D prescription drug plan in order to avoid late enrollment penalties, unless you can get this coverage through another source, such as through the VA or an employer plan. This other coverage must be considered creditable, which means it has to pay at least as much as Medicare's drug coverage. Medicare supplements also don't include dental, vision, or hearing aids, and if you want these benefits, this is something you'll need to purchase separately. Let's go over some key benefits of Medicare supplement plans. It covers the gaps in Medicare, Parts A and B. You have freedom to choose your doctors. There are no networks. You can see any provider nationwide that accepts Medicare. It's portable coverage that follows you wherever you go, even foreign travel emergency coverage. It has a predictable cost. You have a set premium every month. They're guaranteed renewable. Your plan cannot be canceled for any reason as long as you continue to pay the premiums. You can switch plans at any time of the year, although you may have to medically qualify, but there's no annual enrollment. All the plans are standardized. You get the same plan benefits offered by different companies. The only difference is the price. I hope this video has helped you learn the benefits of Medicare supplement plans and how they work. If you have any questions or want help finding the lowest out-of-pocket plan options, then please give us a call or email us. Our service is 100% free, and we're happy to help you. If you like this video, please give it a thumbs up, and be sure to watch our other videos where we go into more detail on the most popular Medicare supplement plans.